So I've just started a new post at the Social and Public Health Sciences Unit, and I haven't really got any experience of working with community organisations or doing any research that is collaborative in that way, so I wanted to really find out about how people basically go about starting that sort of collaboration and partnership, and obviously do a little bit of networking, meet some people, particularly from organisations, community organisations in and around Glasgow.
I would mainly to find out about how this community is working and engage with you as a community and see if you are a community that would enter into dialogue, because I'm interested in looking at how we as I said, increase the quality of opportunity for certain sections of our communities, and I'm looking in to see what your body of work is, whether you're an actual research orientated one that would look into the improvement science that might be to increase participation amongst the quality communities. So it's very much a come and listen, come and interact, hopefully interact a lot, because I think that's how you get to be known, but also how you get to learn about how active a community is and how closed the community is.
I came along because over the last 7 or 8 years that we've been working with a really strong partnership with Glasgow University. Over that period of time we have undertaken a dozen or so evaluations with students from Glasgow, and I wanted to learn how other people do similar work, and I also wanted to be able to put some points of view across about how work like this could be developed better in the future.
There's a really good mix of people in the room today, and it's great to see so many people interested in more collaboration between researchers and community and other organisations, because that's very challenging. All the researchers in the room will know that actually we're increasingly constrained. We can no longer go out and do what we want with communities. We have to conform to things like the Research Excellence Framework, and we're judged by the number of peer-reviewed papers that we get published in well-esteemed journals, and none of that actually interests communities a lot. So there are real career penalties for researchers who want to do a lot of research with communities. And this is one model of what the actual research cycle might look like. This is the ideal in theory. You diagnose a problem, you identify it, you plan some action, you take some action, you evaluate it, you learn from it, and you go around again, because it's a cyclical, it's a spiral process. So you're constantly learning and improving. But of course the reality is that projects were at different stages of preparedness to be involved. In projects that really had a very low opinion of research, because they'd been research for decades and they were suffering from research fatigue, they had to leap in at the action point and do something quick and learn from that. Others decided that they would evaluate existing initiatives, because going in cold to a community and trying to engage them is quite a tall order. But of course, this is about research, not just community development. So I'm going to go very quickly through some of the key processes that made this a success. And the first, of course, is the depth of engagement with and the closeness to the groups and communities that were involved. Without this, none of it would have worked. But we all know that this is very slow and intensive work. Projects told us that the first year was spent merely building relationships. You need that kind of investment to release the capacity of communities. So you need to have that level of trust. You need to also to be able to make a difference. Working in partnership took different forms across SHARP. Some of them were committees, some of them were networks, some of them were activity-based. And again, it takes time, effort, and commitment to achieve productive change.
We'll start off that we've asked the kind of case studies to give a little bit of a brief description about, say, how they started and kind of what the project is, how it's kind of gone. And then we want a kind of group discussion around about some of the things that are successful, like what kind of works in these kind of partnerships, maybe using that as an example. I'm sure other people will have examples at the tables. What maybe didn't work so well through the experiences, or what might not work so well in these processes. And then the kind of last one we were kind of interested in was people's openness or kind of barriers that they see being put in front of them to doing this kind of collaborative research. That might be funding. That might be, you need the training to do it. That might be that you're simply not allowed to, and the type of job that you do, they don't kind of let you going outside of doing too much.
And then an overarching thing which has come out again and again for me was trust, and the importance of trust with it. And I think that I kind of felt that was throughout the whole day, even down to the kind of Tai Chi. And I guess I personally learned that people are prepared to try new things if you're going to push them in a kind of safe environment. And I wasn't sure if the Tai Chi thing was going to bomb or whether it would be alright, but I thought
neither was I, to be fair.
I thought it was really successful. But I think this is important in terms of partnership as well, and I think that it's not really been talked about, but I wonder if there's a potential for a sort of power imbalance between community groups and between academic researchers. I don't think anyone's said that yet, but I think that community groups, to my mind, need to be wary of the kind of helicopter researcher who comes in and does their work, takes what they want and leaves again. And I think that today's not been about that. It's about actually bringing it and being a proper partnership and a relationship like our own relationships which we have in our own lives.
Personally very enthusiastic and very energised about today. So we've identified three things that we think could make a fundamental difference. First one is about knowledge capture systems and what happens to research, especially from a third sector point of view. Where we tend to do bits of research, it's put in an envelope, sent for funder, and that's about it. And we're lucky we'll dig out a drawer at one point and try to use it again, but very few other people will. I've been learning huge amounts from other projects today and huge amounts from other teams that aren't really from my background, food and health. It's the same issue as food. This morning's presentation, you could have written that about healthy eating projects, I guess you could have written about healthy living, you could have written about anything. So how do we learn from people that we don't normally speak to? Third sectors are absolutely hopeless after, despite the best efforts of checks and community food and health and the like. We tend to go in our own silos, and if we're lucky to speak to people in their own silos. We don't speak to people in other silos. So I think there needs to be something that develops about today's network, if we could call this a network, about let's make it work.
I think in terms of like sharing good practice, learning, it's been a really good event to be able to exchange information and key learning points from other people, from other organisations, whether it's in research, whether it's in public sector and the voluntary community sectors. And I think there's probably great potential for future events to involve similar organisations like ourselves, no matter how big or small you are within the community and voluntary sector.
That is to meet people, which I think has happened. It's been actually brilliant for that. Just the informal nature of the breaks and the exercise session and things like that has been really good. The roundtable discussions as well have been really informative and helpful. Yeah, there's been a lot of discussion about how you can sort of formulate partnerships formally and informally. I think it's all been really helpful. So it's been a good day so far.
I've so far learned that you're quite an open community, that you come from quite far and different backgrounds, all interested in the public health agenda, which is quite disparate at times, but there's some central golden threads going through that. So it's been quite useful, and coming to these sort of events gives you ideas about going away to form partnerships or to have further conversations and shaping what you may be working on, maybe setting out a few more parameters or pushing back a few more boundaries in what I'm doing, and bringing more people into the conversation about what I'm doing.
Well, first of all, I think it's been a fantastic day. I think the ability to sit at table with people you wouldn't meet and from areas of expertise that you wouldn't meet has been wonderful and very energetic, and I think it's been a really excellent event. What I'm trying to get out of it is, for our purposes, to look at things that we could maybe do better and to expand what we're doing. So learn from other people how they do their work and how the collaboration between ourselves and Glasgow could be developed based on practice that other people have. And as I said earlier, there's another bit for me which is about influencing, say, policy and developments in the future so that we can expand what we're doing by using the benefits of the linkages we've made today, the people we